Weakness at the lower extremities is one of the biggest predictors of falls in older adults. So it's important that you build strength right away. I'm going to show you a few exercises today that can help you build strength in just 1 to 2 weeks. It seems impossible, but there is a way. It's not through your typical bulking up your muscles or building up the muscle. It's through neurophysiological strength gains, which is different. It's the brain to muscle connection. So we want to build that, make it stronger and more efficient to reduce your risk of knee buckling or legs giving out when standing or walking. I'll show you those exercises. Let's get started right away. Okay, we're going to get right to it. You can use a pillow. I just didn't have one readily available, so I'm going without. The first one we're going to use, I'm going to use a ball. You're welcome to use a rolled up towel or a pillow. I feel like the ball works well, but whatever works best for you if you have something laying around the house. But you're going to place that behind your knee, and you're going to contract the front of your lower leg and the front of your upper leg together. So in order to contract the front of the lower leg, you're going to pull that foot up, and you're going to push the back of your knee down into that ball. So it's like you're straightening out your leg and then trying to smash the ball. Okay, you'll really feel a lot of tension and tightness through that leg if you're doing it correctly. Hold it for about 5 seconds and then relax. Hold it for about 5 seconds and relax. Make sure you do it on both sides, right and left. You don't want to neglect one or the other. This is a great exercise to do if you've got arthritis in the knee, because essentially it doesn't require a lot of range of motion that might irritate or aggravate that arthritis. With that, again, we're working on that brain to muscle pathway. Pulling up that foot, tightening up the front of that leg, and trying to smash that ball down. Really hold that contraction and relax. If you can do this 2 or 3 times a day, that would be great. And up to 4 or 5 times a day would be fantastic. The next one we're going to do, you don't need a ball or anything. You're going to bend one knee, hold here. You're going to do a similar contraction, the front of the leg, on the upper part of the leg and the lower part of the leg. Pull that toe up. That helps contract the lower leg. And kind of almost like you're trying to smash the knee down into the mat or into the bed, whatever you're using. And then you're going to do a little leg lift. It's important that you do this nice and slow. So part of creating that pathway to the brain is really methodical tightness of the muscle, methodical movement, up and down. I can feel my muscles even quivering a little bit, and I'm a very fit person. I do a lot of exercise, and I can feel that muscle working. So you should feel some tension in that through the lower leg and the upper leg, especially in that upper thigh. This will help with that knee buckling and that leg giving out when you're walking or standing. And then the last exercise we're going to do, we are going to use a ball. So squeeze the ball nice and tight between your legs. And I'm using a gait belt. If you'd like to get a gait belt on Amazon, that would be fine. If not, you can use just use a regular belt that you put around your pants. But we're going to link this together here. Tighten up that belt so it's pretty tight. And you're going to squeeze that ball. Try and squeeze that ball nice and tight. Hold that contraction 5 or 6 seconds, and then you're going to do the opposite. You're going to push out on the belt. So push, 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 and then squeeze, 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 squeeze. You're going to want to do 15 squeezes and 15 pushing out. If you find that you're doing 8 or 9 or 10 and it's difficult, you can stop there and just build your way up. There's no right or wrong here. Essentially, we're just trying to progress you at the pace that you need. Not everybody's the same, so do what works best for you. Again, 5-second squeezes, 5-second push-outs. Feel those muscles working. Hold it for the good time and push pretty good. Not lightly, but push pretty briskly. And that will help, again, connect that brain to muscle pathway. If you have found these exercises to be helpful, please subscribe to my channel. I will leave a link below for another video if you'd like to check out some of my other videos. I appreciate your viewing, and I look forward to seeing you at the next video. Thanks.